Okay, thank you so much, Ashling, for the introduction. And hello, everybody. Nice to meet you. My name is Rea. I'm the clinical nurse specialist in sexuality and disability in the National Rehabilitation Hospital. I have a background of a spinal nurse. I'm a spinal nurse. I also have a background of other areas in nursing, such as pediatric, medical surgical, um, urology, different types of backgrounds, but I specialize now on sexuality and disability aspect post rehabilitation. So let me just share my slide before I. Okay, see that. Just checking if everyone can see this presentation there.
Yeah, we can indeed. Right. Thank you.
Perfect. Yep. Is it clear enough?
It is. Yeah. It looks
Okay.
perfect to me, and everyone seems to be nodding, so we're doing good.
Okay, perfect. Because I can't see everyone on the screen while I'm playing the slideshow. So just tell me to stop if you have any questions, or I'm happy to answer all of your questions after the presentation. So our topic today is going to be relationships and sexuality after stroke. So why is it important talking about sexuality after stroke? So back in the days, as far as the 70s and the 80s, there was a study on individual who had experienced stroke, and they identified some of the issues were, physiological changes, behavioral, psychosocial factors, which includes relationship and has also impacted sexuality and sexual function. And they have identified that sexuality is an integral part of a person's overall well-being, and it's often the missing part of the piece in terms of recovery. So, as we all know, stroke has a profound impact on not on one person. And sorry, there I can't seem to move the arrow. Do you have access to it, Ashlyn?
No. Do you want to check? Maybe on share and try it again. Maybe see because I
Oh,
don't think
there you
I.
go.
Oh, fantastic!
Can
Happy
you see
days.
it?
We can indeed. Yeah.
Okay, great. And one stroke survivor said, it's as if somebody came in the middle of the night and stole a part of me that I never got back. Stroke is more than an invincible, stroke is more than what you see. It's an invincible disability in a visual world. So after stroke, many survivors can walk, can talk, or manage their daily activities, or even go back to work. To others who lack understanding of stroke, it may seem like this person have fully recovered, but not all disabilities are visible. There's fatigue, memory problems, um, you know, left-sided weakness or maybe right-sided weakness, changes in sexuality, feeling a sudden loss of your former selves. There are invincible effects of strokes. And when sexuality is silenced after stroke, the silence can leave survivors and partner or even family members isolated without support to navigate changes in their lives. So before we start, I just want to ask, what is sexuality? Like, if you look at the sexuality wheel from HSE and we base it on the definition of the World Health Organization, sexuality is a central aspect of being human throughout life. And each one of us has a sexual right that needs to be protected, respected, and fulfilled. So, sexuality encompasses your values and experiences from the time you were born till present, which contributes to your personality. So, do you know that from birth we already begin to cultivate our sexuality through emotional connection with our parents? So, we discover that when we cry, touch provides a sense of security. So it's your gender expression, meaning it's how you express yourself, your role to your family. Sexuality is also gaining an increasing recognition that it's more than the act of having sex. It includes making relationships, your self esteem or your self image. It's the tactile expressions, a sense of belongingness, and the need for closeness. So, how does stroke impact your sexuality? So, it has a profound impact on how you feel or perceive your body after going through bodily changes, the way you're able to participate in roles. Are you a mother, a father, husband, wife, sister, brother, aunt, uncle? Um, Even to doing activities that could include how you express your sexuality, things like getting dressed, your body image, um, how you choose your hair color, your hairstyle, the way you communicate, holding your hands while you're out on a date with your partner. This could all be difficult to cope with, but with given with the right support, you're able to adapt. So this is a study done in 2018, which talked about the barriers to discussing sexuality to a doctor or a healthcare professional. So, majority of the patients actually answered embarrassment and nervousness because sexuality is rarely discussed because of the stigma attached to it into our society. And if someone brings it up, there's often a fear of being judged and the information being kept private. So, this is the third factor as well. And it wasn't openly talked about. Back in the days, people were unsure how to respond. There are cultural and religious aspect of it that play a significant role, and there's a widespread spread myth as well that people with stroke or with any sort of disability are asexual, meaning if we put it into layman's term, it's they're not interested in sex, has no sexual feelings towards other, or not attracted to anyone. And I just want to correct that. That's just actually a myth. And I've even heard people saying, I'm afraid to go back to being sexually active with my partner because I'm afraid that it would lead to another stroke. So I just like to correct that. That's just a myth. And we'll go through all of those things later down the presentation. So, why is it important to talk about your sexuality? Sexuality is a key component for your overall well being and quality of life. Um, sexuality, sexuality changes in response to maturational, physiological, social, and psychological events, meaning if a person has a medical diagnosis, it will impact a person's self-concept or how you see yourself, your self-esteem, and your social relationship. And also, stroke survivors, your family, your partner may also benefit from strategies to support adjustment to post-stroke sexuality. So there are effects um, of stroke on sexuality. So, as we all know, stroke is the most common cause of brain injury. When we're looking at stroke, we're looking at the part of the brain that has been damaged. So, different parts of your brain can affect different parts of your sexuality, such as for the thalamic injury, um, which is responsible for your sensation. So therefore, there could be a reduced sensation with touch, pressure, pain, temperature, body position. And with the hypothalamus and the pituitary gland, as we all know, pituitary is responsible for the production of hormones in your body. So it could probably impact your hormones. So there could be hormone imbalances, and an individual might need hormone replacement therapy. Um, Also, there could be problem with regulation with temperature, and an individual could go through precocious puberty or a puberty that starts before the age of 8 years old. There's also cerebral injuries, um, which could impact movements. So things like clumsiness, tremors, poor balance, slurred speech could be present. And for the brainstem injury, it could be more of the physical aspect. So there could be trouble sleeping, you might notice that you have been extremely tired after doing a certain thing. You have low energy, reduced motivation. And for the frontal brain damage, this is responsible for your emotions and behavior. So there could be impulsiveness, difficulty focusing or processing information. There could be mood swings and loss of self control. For the temporal lobe and the limbic system, there could be problems with taste, smell, hearing, your memory. For some of you, you might notice that your memory has been short term. processing information might require longer time to process. You might have seizure, impotence, or hormonal changes. So all of this could impact the way how you respond or how you react, or as we call it earlier um, on the web earlier, it's what you call the gender expression, how you express yourself in your society and in your family or in your community. But know that there are also positive impacts of disability in a relationship. And sometimes it brings partner or family stronger. It strengthens the relationship, and it reminds people to not take life or each other for granted. Previous irritations or conflict does not matter the same way. And some couples said, if we got through this, we can get through anything. Some couples and or family spend more time as well during the recovery phase or the rehabilitation phase. So the next part, this is just a study that I wanted to show you, which was done by our psychologist here in the rehabilitation, and she made this dissertation, and she wanted to find out how relationship can be affected after acquired brain injury or stroke. Um, and one of the things that she was presented was the loss of equality. You know, things can feel unequal because the person post stroke may need to rely heavily on their partners or family for everyday support, such as for the activities of daily living, the shower, changing, transfer, feeding, medication. This shift can be challenging for both sides. Therefore, there's a loss of a sharing relationship. And this could also lead to loss of companionship. Many describe as well how friendship gradually fade away after stroke, resulting in a sense of loss of confusion and social disconnection, especially if you have to deal with fatigue. I know some people had to um, maybe see their friends less often because they experience ex- um, very extensive fatigue, and they have to always plan their week ahead of time just to make sure that they do get rest in between during the day. Um, there's also change roles and responsibilities at home, which I'm going to discuss in a while as well. There might be staff in your home, or for other people, there might be caregivers coming in and out of your personal space. This can be a bit awkward and unfamiliar, but take time to communicate and create a comfortable space for a supportive environment for everyone. There's also loss of emotional connectedness, expression, and reciprocation. Sometimes, when an individual goes through stroke, um, they some partners said that, I have to ask my partner to give me a hug because there's a reduced ability to recognize others emotion. And I just want to show you this study in 2012, asking a wife of a partner with brain injury. She said there is a loss, mainly because you're grieving the person that you knew. There is the grief over the lack of support, the one person in the world that you have always turned to for support and to give you what you needed, to hug and say, it's going to be all right. It's not able to give you that anymore. So there's a sense of aloneness that starts to manifest itself in everything that you do. A lot of times my reaction is to become irritable because I'm having to carry a responsibility that I'm not conditioned to carry. So as you can see from her statement, that the dynamics in the relationship has changed, and um, because the other person feels isolated and withdrawn to the family member, the other family member is also grieving for um, the lack of support. So the next one is also communication. So individuals with stroke suffer to communicate, especially if a certain part of your brain where speech is affected. And sometimes, it's easily to withdraw yourself from the family due to the difficulty expressing your thoughts or emotions. Or for the other partner, it could be like living side by side with a person you love, but without anything to talk about. Stroke causes this change in personality and behavior, and some individual may easily get annoyed, might get irritable easily, may be emotional or aggressive. This could lead to the injured person feel like a stranger who is no longer recognizable to their identity pre-stroke, and this causes tension for partners and even more stress if there is the increased involvement of other family members. There's also the fear of going into debt if they develop gambling issues or if they don't understand about spending money. There's difficulty knowing feelings of partner, or sometimes post brain injury some individuals may experience significant loss of motivation. Have you um, ever spent long periods sometimes in being inactive, sitting and watching TV all day? um, the lack of drive is the indirect consequence of the stroke, but it's unintentional. It could be due to a loss of purpose or just mainly because of the extreme fatigue. And sometimes no one really understands how extremely fatigued you get. And it's just really important to say it out there to your friends, to your peers, to your family that this is the side effect of stroke. And understandably, this could also lead to feelings of frustration in the partners or family who may want to see more engagement or activity. So there could be changes in interpersonal style and relationship dynamic or even sexual function. When you have a low mood and when you're worried or anxious about something, sexual function could also be affected. But we'll talk about later how sexual function is also affected by some of the medications that you might be taking. So, like I said earlier, there could be changes in the roles in the family, especially during the initial phase of stroke. Um, Maybe for some of you who were likely employed before the stroke, may now need to depend on social welfare or take the role of a care receiver. So while their partners may be faced with major responsibilities of continuing work while also acting as a caregiving and looking after your kids. So this creates being a care receiver creates a sense of meaning, but this could also shift to guilt for not being able to be there for their family. But as the role of the care provider or the caregiver, for every human, it's a natural act to provide care, especially to the people that we love. But this could also shift the dynamics in the relationship and can become a source of stress. So, loss of sex drive and intimacy among partners because of the change in the dynamic in relationship could happen. And some people would describe their relationship as not just no longer a husband and wife or a partner type of relationship, but they would say to me that the relationship has now shifted into being a patient and carer type of relationship. And being a carer, this makes a partner feel less attractive being a mother instead of being a wife. But on the positive note too, some people may have a sense of emotional rewards being the care provider. So, however, even though it's natural for a family member to step in and do everything for the survivor as an act of love, um, the truth is independence is an important part of your recovery and long term well being. Um, there was a statement that was said from a research that because he's so independent on me and I'm more like a mother to him, it doesn't feel right that we have sex. So basically, the shift in the dynamics in the relationship could also lower and impact the sex drive of not just your partner but as well as for yourself. And that's I'm not saying that this is not normal, but it's it's um it's quite common after stroke. So for the coping strategies, remember from stroke, it takes time, and it's important to be patient with yourself and be persistent in implementing coping strategies. So the first one here is be considerate of the fact that this is probably a stressful time for you and your partner, And it takes time to accept new life situations. So give each other time to adjust. It doesn't happen just overnight. Recovery takes years. And tell each other how you feel about any changes in your roles, even if you hard it fine to talk about it. So, like, I understand for some people, they're not comfortable talking about their emotion, but know that talking about sexuality after stroke is such an important aspect too, because we're not just looking at the functional aspects of recovery, but we're also looking at the holistic part. We're looking at the emotional, we're looking at the psychological, psychosexual aspect of impact of stroke, and focus on new things, people that help you stay strong as a couple. So stroke changes the way you connect with friends. Sometimes you may feel friendship has shifted, or it's harder to join in activities like before due to fatigue or physical limitation or cognitive difficulties. And sometimes friends don't really understand what's going on after stroke because it could be something new to them. So talk openly with your friends, or if you feel that you need a better group of circle, build a new support circle and ask yourself, how have your relationship changed since stroke? What helps you cope with these changes? Help them understand these changes from the stroke, and only then you'll be able to get better support from the people around you. If there are if there are things such as work you had to give up, try not to dwell on them and focus on what you can do and the ways you're contributing. And don't compare to yourself right now to how you were before, because comparing is not going to help you at all. It's just going to put you a step back in terms of your recovery, and celebrate small achievements and progresses. So if you're a survivor and functional in many ways, you may notice that task takes more time or require different strategies, and that's okay. What matters is that you continue to do what you can at your own pace and never compare yourself to anyone, because recovery is quite different. And for family or family members, partners, it is common to protect a loved one, but this can unintentionally hold your partner back. So encourage them to be independent. Like, you know, if you're scared for them to make a hot cup of tea because they're kind of weak, maybe supervise them with making themselves a hot cup of tea. Even if it takes longer and it isn't perfect, the sense of accomplishment is far more important than speed. And for young survivors, remember that your parents won't always be there to do everything for you. So the best gift that they can give you is the chance to rebuild your confidence and learn skills. So even as simple as preparing your meals, managing your schedule, making your own bed, or as simple as doing one household chore is very important to develop that skill. Just to make sure, for some people, when you're bending down, it might cause a bit of headache. So make sure that you don't bend your head, but bend your knee while you're reaching something at the bottom. Another research was also done to obtain a partner's perspective on how to cope with difficulties in relationship. So she said, pick your battles and evaluate the importance of a conflict issue. Listen to thoughts and feelings of individual with stroke and not to discount their importance. And take time away for yourself. Um, your time together and your time apart are equally important. So it's okay to feel to take give each other space and take time away to think about what has happened, especially you've spent a whole lot of time together during the recovery. It's okay to take a break and do the things that you enjoy doing for yourself. um, Go through therapy and counseling. You can get so many hugs before you realize you need more help. Process of acceptance of even negative changes. Take one day at a time. Avoid looking too far into the future and using humor. Um, this study was done in 2024, which is a recent study about stroke and which talked about the correlation of family resilience and self efficacy. So, self efficacy means believing in your ability to manage your health or your daily tasks. So, the study found that when stroke patients feel confident in managing their symptoms and staying active, their families tend to function better. So, a supportive family environment called family resilience helps survivors feel more confident. In turn, this confidence, or what we call self efficacy, helps improve how the family works together and copes with stroke recovery. And efficacy has been reported to be positively associated with quality of life. For single people, maybe some of you here are asking, how do I meet potential partners? So don't let the stroke become your identity. You know, ask yourself, how did you meet people before your stroke? So chances are you ran into them on every avenue of your life: work, restaurants, events, supermarket, bus stops, name it. In fact, the only place you didn't meet dates was sitting at home. The same issue is true now. Get back into circulation. Of course, it might be more difficult to meet people because of the wheelchair accessibility, or some places just no longer are of interest to you due to accessibility limits, or maybe noise, which could trigger some seizures. Environment, find new place that will meet your needs. And other people also ask, when is the right time to talk about my diagnosis or the stroke? It's important that you, um, you should talk about this only when you feel comfortable and safe. So each of you have the right to privacy, and you may feel that the issue with your injury is personal. If you decide to talk about it openly, it's wise not to overwhelm your partner with so many details. See how much this person is able to take about you, and be honest and answer your questions if they arise. Um, a lot of people who have an invincible stroke seek to limit disclosure by staying away, or you know avoiding social groups, or talking about themselves. But there's no there's nothing wrong about that. Talk Normalize talking about these things. There's so many we learn from our culture that you have to talk. It's you know you can't talk about sexuality because it'll make you appear like a bad person, but it's that's not actually true. And even studies nowadays have shown that how sexuality is such an integral part of ourselves, to recovery. So be honest and answer questions. And if you and your partner are sexually attracted to each other, consider talking about your feelings and practical aspects of sex. So the more you share about your sexuality, the less you feel anxious during intimate times. Other special things to consider before getting involved into a relationship is to talk about what is important for you in a relationship, and look for a partner who shares similar values and beliefs. Even though some issues may not be important for you when you start dating, but they may become increasingly important as the relationship matures and becomes more serious. And I just want to highlight um, consent and self worth. Research shows that people with disability can be more vulnerable to entering abusive relationship due to the lack of self-esteem, or often because they underestimate their worth and they just settle to have a partner. It is important that before you enter a relationship to work on your self-worth first, and also the role of consent is equally important. Healthy relationship is based on mutual respect and freedom of choice. So if you ever feel controlled or pressured into doing something that doesn't align to your values or makes you feel uncomfortable, that is a sign that it's not a healthy relationship. So it's really important to, you know, look at yourself and really value yourself. And it doesn't matter what other people think of you, but if you value yourself, you prioritize yourself and your mental health. So, medications could also get in the way of your sexual functions. It could reduce your sex drive, arousal, orgasm, ejaculation, or your general satisfaction. So, these are the some of the medications that you probably are on, and it's common. So, antidepressant, meaning your medications for your mood, antihypertensives, medications for the blood pressure, tranquilizers for your to help you relax, antipsychotics, or like I said earlier, if your pituitary gland is affected, you might be going through any hormonal therapy. So, hormonal agents could also impact sexual function. There's lipid lowering agents for your cholesterol, medication for seizures or anticonvulsants medication, medications for Parkinson's disease, your ulcer medication, chemo drugs, um, your your drugs for your bladder, your anticholinergics, or even alcohol and recreational drugs. This could all affect your sexual functioning. Um, so, sexual performance may be affected directly or indirectly by a variety of agents. And as we said earlier, for normal sexual function, you have to be at the right frame of mind. Um, your um, your hormones should be intact. Your nerves should be functioning. There should be a good blood flow in your system. And drugs used in the treatments of various medicals or um, medications of various conditions may adversely affect one of one of the physiologic mechanisms that underlay normal sexual function. So even medications such as for your mood could have impacts on your mental alertness or even for your social interactions. And so I wouldn't really say to stop these medications if you're taking any of these medications, but if there's any way for you to discuss this with your GP or your consultant to maybe lower down or taper down your medications, that would be good. But to totally discontinue it, I wouldn't without the advice of your medical consultant. Because even though there could be problems with your sexual function, there are always aids and appliances to help enhance your sexual functioning. So for the females, we have lubricants, vibrators, dilators, and we have eros therapy. Especially, this is designed for women who have a lack of sensation on on their genitalia. And for male, we have the oral erectogenic agents, such as the likes of Viagra. And then we have the intracavernosal injection therapy, which is an injection directly into the penile area. We have the vacuum pump and the penile implant. Penile implant would be the last resort, and I wouldn't really recommend this. I would sort of trial these three things first before going to the last resort because this is invasive and it's permanent, it's irreversible, and there's a higher risk for infection. And for fertility, some of you might be curious about fertility options. So for females, it is advised not to get pregnant during the first year of your stroke. And if you're planning to use contraception, be careful as there could be higher risk for clot, especially if you have ischemic stroke or stroke that comes from a clot. So if you're interested in accessing contraception, talk to your consultant first before using it. And if you're planning to be pregnant, there's a slighter higher risk problems with fetus due to the medications. As I said a while ago, some of the medications that you could be taking, like the likes of your blood pressure or your anti-seizure medication, could be teratogenic, meaning it could cause birth defects to the baby. And most of the medications for blood pressure, cholesterol, seizures could also affect fetal development. However, these medications can be assessed by your pharmacist and your consultant together with a OBGYN, and they can run a risk. You can go to the pharmacist where you get all your medication and let them run through all the medication that you're taking and see if your medications have higher risk for um, for your baby. But it depends what type of stroke as well. We all need to look at what type of stroke you have had, the severity, how does this impact with caring for a child. And some medications could also be changed, like the likes of Keppra. So Keppra is for um, seizure. So the newer generation now, like Keppra, is safer for pregnant women instead of the classic medications such as the sodium valproate. Um, there's loads of options. Talk to the fertility specialist in the fertility clinic if you want to also plan about preserving your egg or your sperm. But at the end of the day, have those have your consultant liaise with your fertility specialist and your pharmacist. So for fertility programs for people who have difficulty with maybe ejaculation, there's a thing called Ferticare Vibrator, which is a medically approved device for people who have good hip flexion. So this is done at home, which is an insemination kit and should be planned when your wife is ovulating. And there's another thing called electro ejaculation, which is also done by your consultant neurologist. And it is done under general anesthesia. And the procedure involves inserting a probe to stimulate the prostate. And then when they do collect the prostate, you have the option to freeze the sperm. And there's a thing called ICSI or intracytoplasmic sperm injection, which is another high tech version of IVF. So it involves injecting a live sperm into a person's egg in the laboratory. There's epididymal aspiration, which is a sperm retrieval method where sample of your sperms are removed from the epididymis through a small needle attached to the syringe. And the last one is testicular biopsy. This is done for semen analysis, and they create a small incision on the scrotal area, and a small portion of the testicle is removed for examination. And for women who are young and don't have any partners, you could also opt for egg freezing. But I would try to consult this first with your neurologist or your consultant because I know that they do administer you have to take few hormone medications for the quality of your egg and for your ovary to produce multiple eggs. So talk to your consultant about this and see if it's safe for you. So some tips, about talking about relationship and sex within a couple. So communicate even difficult topics to deepen feelings of connection. Find opportunities for closeness that don't involve sex. Sex is, as you can see earlier on the first part of my presentation, sex is just a small part of your sexuality. Focus on the non sexual aspect of your relationship first if feel that you're not ready to go there yet. Or plan a special activity together. Choose something that accommodates you and your partner's needs. Um, Maybe for some of you, you prefer a quiet place or you prefer a wheelchair accessible place. Plan it together. It's really important that you talk about these things together as a couple and show appreciation for one another in small ways, such as saying thank you, writing notes, buying small gifts for one another, and respect the need for alone time and space. So if your partner is looking for space, respect that space because allowing your partner to have a good headspace would also improve your relationship and the communication in the relationship. Redefine the goals of intimacy. Intimacy is not just about sexual intercourse. It's about emotional connection that you have for your partner. It's the need to be with someone. It's the closeness, it's the bond. So redefine what is intimacy for you right now, and how could we change the dynamic of our relationship into becoming a carer and a care receiver type of relationship, and how can we shift it back into us being normal again. Create space in your relationship to experiment. um, like I said earlier, I've worked with some couples who were afraid to be sexually active because they think that it could induce another stroke if they're being sexually active. So it doesn't actually, as long as your blood levels are within the normal range and you're taking your medication, then it should be safe. So make use this time to experiment in your relationship and schedule opportunities for intimacy. And when I say schedule, I mean literally schedule it. Sometimes things or intimacy might require planning just to help you with your confidence as well. And spend time doing things that you both enjoy doing. So, what can help? There are coping strategies. So, recognizing that irritability breeds irritability. So, learning how irritability might influence others respond to them. So, if they're irritable, make sure that you allow your partner to have space, because it's only going to make it's basically contagious and it makes you irritable too. So allow each other to have that space in the relationship. Recognize triggers of conflict, such as interruption during a task, feeling overwhelmed, or multitasking. You need to communicate this with your partner and say, I can't really multitask. If multitasking is an issue for you after stroke, you might have noticed that your information processing may take time, or doing a task feels lengthier now because you're a bit slower to do with those things. Explain all of this to your partner and allow your partner, allow yourself to do certain tasks, even if it takes longer for you to do certain things, because independence is so important. Education regarding emotional connectedness, recognizing and expressing emotions relating to brain injury, and discuss expectation. Agree a list of expectations in your relationship. So when you're addressing sexuality, you can talk to your consultant, your neurologist, your nurse, your healthcare worker, um, urology, or urologist, or your psychologist, your medical social worker. There's no shame talking to about your sexuality. It's really good that you raise this concern to any healthcare professionals, because they would know where to signpost you, or where they know where they could refer you. Like, I have a patient and he had a spinal cord injury and he is paralyzed from neck down below, and he also has a brain injury, and he had limited hand function, so he had movements just from his hand and just in a little bit on his neck. And we redefined intimacy for him and his wife. And his wife is his actual caregiver, so which means that she had to give up her career to provide care for him. So we discussed about redefining intimacy for him, and intimacy was more of about his gender expression, how he expressed his emotion to his partner. And um, for him, intimacy would be about learning how to make a cup of tea for his wife every morning. For us, those things might seem very simple, but for him, it means the world for him to be able to make that hot cup of tea for his wife. So, we have to work with um, the physiotherapist and his occupational therapist to help him achieve his goals. It might seem so simple, but that's how he expresses himself and his love for his wife, and also his gratitude for his wife being there for him all the time. And like I said, sex is just the least part of your sexuality. It's more about the emotional connection, and he feels connected being able to show his gratitude for his wife. And you also have the sexual well-being service here in the rehabilitation. So a little bit of overview about what the service do is that we provide help in coping with the impact of illness and disability on a person's sexuality. I provide understanding of the direct and indirect effects of illness and disability. information and aids and appliances to enhance sexual function. I do also arrange appointments for fertility programs and get in touch with our consultant urologist. I do individual or couple counseling, and I also provide psychosexual therapy if required. Um, if you want to be referred, if you're under National Rehabilitation Hospital, that's fine. You can say it to any of the clinicians that you want to access the service. But if you're coming from other hospital or other services like the Irish Heart Foundation, Acquired Brain Injury Ireland, Headway, you can have a referral letter addressed to the central referrals office from your consultant or your GP. And if you're here in the National Rehabilitation Hospital and you're currently involved in any of the programs, you can either contact the service directly or ask one of your clinicians to make a referral on your behalf. So, thank you so much for listening, and I hope you learned from my presentation. Thank you.